Denise, one of the most common things that we're addressed with on questions from expats looking to come here is healthcare,
Hmm.
insurance, the costs, and the quality of it. Perhaps you can shed some light onto that for us.
Yeah, my husband and I, we have Umana, which is like Umana.
Oman is
Umano.
worldwide.
Yeah,
Oh, yes.
exactly. And so my husband is 65. And so usually if you were going to get a healthcare plan, it would be really expensive, our insurance. But we pay $800 a year. And so with that, everything is pretty much covered at 80%. If we actually have to go into the hospital for a hospital stay, that's at 100%. Everything, all the medications, whatever during that hospital stay would be at 100%. And what I really like about their medical system is that you know the cost up front. Everything is transparent. You go in, you want to see a specialist, you go straight to that specialist. You want to go in to get new glasses, you go straight there, and all of that is basically part of your insurance. Sometimes you might have a little bit more of a copay depending on the specialty, but you can get really, really good care that is specific to your needs, and you're able to look around because it's all transparent. It's not like in the States where you have absolutely no idea what anything is going to cost. You're just basically given that information after the fact, and then it's thousands and thousands and thousands of dollars. Here, my mother, she lived here with us for a couple years, and she had to get an MRI. And she didn't have insurance here, and it was $200. So it just was, incredible. And when we were done, they actually gave us a CD that had her brain scan. And when we went to the States, we were able to use that exact same CD, and the doctors were able to have that information for $200, and that's with her not having any insurance here.
So, price is a very important factor in any decision, but perhaps can you touch a little bit more for me in terms of the quality of the care? I know many of the doctors have been educated in Cuba,
Hmm.
East India. Some of the finest educational minds are here in these hospitals. And can you touch a little bit on that because I know you have quite a bit of experience.
Yeah, because like I said, my mother was here with us, and she suffers from vascular dementia. Um, I was, always trying to make sure that she was taken care of. We did travel a bit to make sure that she had the best doctors, for podiatry, for as I said, she had to have an MRI and other things. And we really found that with good references and just a little bit of research, you can find excellent, excellent doctors here. And then you have a reasonable uh, charges for their services that they're providing, and it's all transparent. You know what they're going to charge, and so you get quality plus also you're able to afford it.
Some of the things I've heard over the time I've been living here is even major procedures like heart procedures
Hmm.
and what have you that would literally break a person in some countries, even without insurance here. And I do mean with the exceptional care, private nurse, private room, even open heart procedures,
Hmm.
bypasses running complete around 18,000 US.
Hmm. Yeah, yeah, definitely.
And a person a person has a lot more options that way, where insurance is in the realm that it should be, where in Western nations it seems to be the most important thing in one person's life is give everything to the insurance company so you're covered, but only when you need them you find out how you're not really covered with out-of-pocket costs that are soaring. In some instances, I've heard $50,000, $60,000
Yeah.
out of pocket, even with insurance. And This country is just not that case, and it certainly isn't anything to sneeze at when the quality is there. As far as even plastic surgeries
Hmm.
and certain procedures, the Dominican Republic, most people are not aware of this, has a large fly-in surgery type atmosphere where people come, they get their procedures done, they relax at a villa
Right.
while they're recuperating, and all for a fraction of the cost.
Exactly, exactly.
Have,
No, yeah,
it's amazing.
it's true. In Santo Domingo and Santiago, there are, a huge um, hospitals that were designed really for expats with them in mind, as far as making sure that they have, the best technology, but then at a reasonable cost. And it just shows you that the costs in the States have just exploded, not because of what they're providing. It's because of all the other layers of cost that they've put on, that have absolutely nothing to do with the quality of care.
While Larry the camera guy was doing some minor technical touch-ups, you and I were addressing good friends of ours, Richard and Judy, who
Hmm.
came here 2 years ago from Houston, Texas.
Hmm.
And we had did a second interview with them because they've groomed their property and now
Right.
they're getting ready for the building of the house. And you were aware of Richard had a surgery,
Right, exactly, and gallbladder
a
removal.
gallbladder
Right.
removal,
Hmm.
and
Hmm.
they that it was. You might not be aware of this though, with a private room and 24-hour nurse coverage. 5 days in the hospital, all medicines, treatments, tests, and everything came out to 3,400 pesos out of pocket. That's about roughly
Yep, yep.
$90
That's under a
US
hundred
after
dollars.
5 days complete coverage in the hospital. So you guys, I don't know if you can compete with that, but watch Richard's video because he'll tell you about the care that he received,
Yeah.
and Richard's not shy to tell you if something isn't right. And for Richard to be that way, he was taken great care of. Anything else you can add on as far as health care and as far as anything else you can touch on that area?
When I was thinking about when I brought my mother here, because I think that may be some issue that some may have, bringing family, what they would be able to provide. My mother was able to live, I mean, like a queen on, of course, the money that she got from Social Security and all of the other stuff. And she had, 24-hour care, and they cooked for her, and they're so gentle and generous with her. Um, and the medical care that she received was, just excellent. So anyone who, is concerned about that, about the medical, I would just urge you to do your research. Of course, use us as a resource, because it is important to get insurance. Car insurance, to do those kind of things that will protect you, but it's just a fraction of the cost that you would pay in the United States.
One of the things that Denise is just absolutely excellent doesn't describe it is after you're here care is what I call it. Denise, a lot of the people that they're very surprised at what domestic help costs, and
Hmm.
so many people that have helped the DR families with full-time maid cooks, and
Hmm.
can you go into that a little bit? I know some of the people are calling me back just raving, thank God for this person.
Yeah,
She's
that's
not
nice.
human, she's great, so maybe you can tell the folks a little
You
about
know what
that.
I think is wonderful about the Dominican culture is that they are very appreciative for work, and it helps them to not be jealous or vindictive because other people may come and have more resources than them. And so I often, because I've helped other people get work, I often get people who are willing to work, whether it's, a maintenance guy or someone to work in the house. And so basically to have somebody come, 3, 4 times a week, and to clean and to cook and, take care of your kids, maybe $150, $125 a month. To have a gardener come to take care of your yard, and to take care of your garden and to do all of that, $100. Someone to live, might be $200. $225 if they're going to be there all the time, and basically, and that's being generous to them. So I mean, it is you can come here and live very, very well, economically.
For a few families I'm currently in contact with, one of their, I think it's diminishing, but one of their hesitations is, I have a mother who's 88 years old and needs constant care. Should that deter them from coming here, or is it like I feel it's quite the opposite? She's going to get substantial better care here.
Yeah, definitely. My mother got such wonderful, wonderful care here. She, was able to walk every day with, the ones who did her laundry, cooked for her, sat and watched TV with her, sang with her, did absolutely everything for her and with us. And I felt so comfortable with them. And because of that, because you are able to get people, you can pay them more, which I did at that time because they were taking care of my mother. I paid them more than probably I would have if it was just they were coming to clean, because of course they were taking care of her. So if you're willing to pay even what at this level would be considered a little bit more, you will get just incredible care, and they'll want to continue working with you and taking care of your family.
So it's actually quite the opposite.
Yeah.
Elderly, like parents of relocation, parents of expats, are going to actually get better care for
Right.
their senior.
Well, I think the reason being is that the people here, they take care of their families. They take care of their elderly. They take care of their kids. If there's, for whatever reason, there's orphans or there's elderly, the family pulls together and they take care of them. They live with them. So the idea of taking care of your family, your parent, your children is not foreign to them. They're naturally generous and loving to family members.
I've noticed over the many years the Dominicans look at age as wisdom. They don't look at it as hampering the family and let's put them in a home and get
No,
rid of
no.
them. It's
There's just
exactly the
there's no
opposite.
homes like that here.
Yeah, it's exactly
Yeah,
the
there's no homes
opposite.
like that.
So excellent, great.